The Merced Police Department will soon have a specialized unit backing them up in the field during certain critical incidents. When responding to situations involving a mental health crisis, officers will be assisted by the Merced County Behavioral Health and Recovery Services Mobile Crisis Response Team. A similar partnership is being established with the Merced County Sheriff's Office. The Mobile Crisis Response Team will support the Merced PD by teaming them with professionals from BHRS that are trained in culturally humble, trauma-informed crisis intervention methods. The participating agencies will operate under a memorandum of understanding, and this team comes together at a time when people are questioning why law enforcement is being used to answer so many mental health-related emergency calls. The city's existing Disruptive Area Response Team, DART, behind me, will work with the BHRS Mobile Crisis Response Team to triage and evaluate individual needs and then provide linkage to the appropriate level of behavioral health services or a community referral. And I would add that this is not a defunding of the police. This is in addition to the resources that we have in our law enforcement community now, and it's a partnership that comes at a very important and crucial time for our city and for our county.
This is a project that found its roots in 2014 through community evaluation of homelessness and mental illness. In recent months, through stakeholder meetings and interviews, the Merced community expressed a desire for mental health support to those experiencing involvement with law enforcement and a behavioral health crisis. When you combine the origins of the original project and the current needs of our community, this was a no-brainer and seemed natural. The goal of our team is to support our local law enforcement when they are responding to behavioral health emergencies, to alleviate the demand on local emergency rooms, and to divert individuals from detention and incarceration to least restrictive settings. A mental health law enforcement collaboration makes sense.
This collaboration, to characterize it as being a big deal would be a gross understatement of how significant this is. Behind the presenters, you'll see our DART team, including the management administrative levels of that organization. And those officers do a tremendous job in doing their best to provide services to especially the community's homeless. And that takes up a lion's share of their time. But as the mayor pointed out, that's always a triage model. With this collaboration, the specialists, the highly trained specialists that will be embedded with these officers will be able to work towards finding lasting solutions for those in need of assistance because of behavioral health issues and, quite frankly, other issues. It's the first in what I'm sure is going to be many puzzle pieces to improve the life for those people suffering with behavioral health issues who aren't receiving the services they need, especially those amongst our homeless community. And I think in doing so, it'll not only improve the quality of life for those individuals, but the quality of life for the community of Merced.